My name is Dr. Liron. I am obstetrician and gynecologist and gyne-oncologist. My specialty is gynecology, and I had my subspecialty in gynecological cancers. During my day, most of my cases are gyne-oncological cases like ovarian cancer, uterine cancer, cervical cancer, and vulvar cancer. I am operating the patients, treating the patients before the surgeries and after the surgeries if they need any chemotherapy or any adjuvant treatment after the surgery. So the person that most influenced my career and was my mentor is Professor Walter Gottlieb. Walter Gottlieb is one of the pioneers in the world in the field of robotic surgery and specifically gyne-oncology surgery at McGill University in Montreal, Canada. And I think that I've learned from him not only how to operate, but how to treat my patients, how to conduct research, and how to combine everything to be a good person, to be a good doctor, good physician, and to be a scientist. So a typical day in my life starts usually at 5 a.m. walking with the dog, driving 1 hour to Hadassah Medical Center. I'm living near to Tel Aviv. Starting my day visiting my patients usually at around 7 a.m. And from then starts the real day. OR, usually that ends up at around 2 or 3 o'clock. And then depends on the day. Most of the days I have afternoon clinic that might end at around 8 p.m. And I wish that it would be the end of the day at around that hour, but most of the time this is the best time to get back to my patients, phone calls, WhatsApp messages, trying to end up my day with my wife and my kids at around 11 o'clock. Okay, so I think that during the last 5 years, the two best or the new things in medicine, in gyne-oncology, were the PARP inhibitors, the targeted therapy in ovarian cancer that we started to use, which brought a kind of a miracle into this field. Patients that were dying of this disease, a disease with that had a terrible prognosis about 5 years ago. Today we are operating them, giving them medications, and we are giving a real hope to our patients. Most of them are alive 5 years after the surgery. This patient with advanced ovarian cancer. That's one field. The other field, which is evolving and being changed every day, is robotic surgery and precise medicine. I think that we are becoming more and more precise. Our surgery are not anymore like huge surgeries, not all of them at least, but we're becoming more precise without damaging other organs. Some of my surgeries are robotic surgeries where we have a kind of a computer between us and the patient, and the computer helps us a lot. It helps us to perform better surgery, precise surgery, and it helps us to detect lymph nodes, and in the future it will help us to detect tumors, and with artificial intelligence it will protect the patients from our mistakes. So in 2030, I think that the AI, artificial intelligence, would be a kind of integral part of what we are doing. I don't think that we would do any step in the OR, surgeries, without a computer that tells us you're okay, Doctor, you're going to make a huge mistake, don't go there, there is a huge blood vessel, there is a kind of ureter there, doctor, you missed a tumor there, and that's the future. I think that these days we live in a new era. In the past, I think that we could tell something to our patient, they would believe, they wouldn't check, they wouldn't read anything, and that was like God said. I think in this era, patients are reading. Most of our patients are very intelligent. Google is there, and things are becoming more and more precise on the other end. We can't anymore offer kind of a general program that was like belonged 30 years ago. We need to tailor the treatment to each patient individually, based on what he needs and based on our preferences. I think that every patient is a different world, and one thing that is okay for one patient would be terrible for the other patient with the same disease. I think that the most important thing with our patient is to show that you care about them. Patients don't care if you know, that's what my mentor used to tell me, but they really know if you care. And I think that you should care about your patient. Before the surgery, they should know everything. During the surgery, that's obvious, but after the surgery, the follow-up after the surgery, I'm in touch with my patient at least a week after the surgery, even though most of them are going home day one after the surgery. I'm in touch with them every day, really want to know the small details of their daily life. It's very important for them and for me as well. Okay, here in Israel we have a huge diversity of food. I traveled a lot during my life. During the last 8 years, I think that I lived in about 3 or 4 countries. But originally my parents came from Kishinev, so I'm really addicted to Eastern European food, piroshki, plimeni. I'm trying to live well. I'm trying to eat a lot of fruits and vegetables. Unfortunately, not always I can do it with my daily life, but I can tell that I'm really trying. I like to run. I'm running at least 3 times a week. That's the best time of my day when I'm running. We're really a regular family. I have 2 daughters at the age of around 9 and 12, which are starting their adulthood. Not easy at all. And I have a young boy around 5 years old, trying to do whatever they want, going to the swimming pool. Used to go abroad a lot, not anymore. So I'm very open-minded to that. I don't know enough on that field, honestly, but I have a lot of patients that are interested in that. I think during the last year it was the first time that we had a course for the med school students in the Hebrew University about alternative medicine. And we brought the best people in Israel to give them the highlights of each field in that. And I was part of that. And I was on the student part. I was a kind of a bridge between the students and the people who came, because most of the med school students, they are coming with the attitude, why do we need that? We don't need it. It's nothing. It's not evidence-based. And I think that from my point of view, patients are asking for that. They want to know about that. So as a physician, I want to know more about that, to give answers to my patient, or at least to know what are the best places to send them, to refer them, so they will get the right treatment. In Israel right now we are at the fourth wave of the COVID-19. During my daily life, I can't tell that I feel it so much because I'm operating oncological patients. They are all cases that cannot be cancelled, so we continue to operate as normal. What I can't tell you and what I can see that many patients that normally would be diagnosed at earlier stage of disease, right now they are not coming to get like regular exams, and sometimes we miss cases of cervical cancer, things that in the past we would diagnose them earlier. Большое спасибо.